Welcome to Mainland, your local regional television station. I'm Tania Omar, and some of the stories coming up in today's news: opinion on Budget 2016 and what that means for folks in the street, natural products changes with new bill, local measles cases climb, and more. The Nelson Marlborough Public Health Service has confirmed a third case of measles, and this person has been admitted to Nelson Hospital since the first case that was reported in a teenage girl who had returned to the region after being exposed in the North Island. Medical Officer of Health, Dr. Andrew Lindsay, has said that the new case appears to be unrelated to the first two and that this indicates that measles is likely to be out in the community. He said that the best thing that people can do is to make sure that you and your children are up to date with the measles, mumps, rubella or MMR vaccine. He said people should check with their GP to be sure, and that your GP can also give you the best immunisation advice for your circumstances. Measles is highly infectious to non-immune people and can spread to others in a waiting room. This is why it is important, if you have measles symptoms, to call your GP or Healthline first before going to your doctor or medical centre. The illness starts with a fever and usually a cough or runny nose and perhaps sore red eyes before the rash appears. Dr. Lindsay says that people born before 1969 and people who have had 2 doses of the MMR vaccine are almost certainly immune to measles. People who have definitely had measles in the past are also immune. The Nelson Marlborough Public Health Service is currently tracking people who have come into contact with the new case. These people will be contacted and informed about what they need to do. If they are not immune to measles, they will be required to go into isolation for 14 days. The man who shot and killed 2 WINS workers in Ashburton last year was found guilty and sentenced to life in prison last week. Since the killings, Work and Income New Zealand have placed unarmed security on every WINS office around the country. The death of the 2 women WINS workers also sparked debate about the treatment of people needing help from WINS around the country. To find out about how people are feeling about WINS since this incident, we asked people in Nelson about how their dealings were with the government agency.
Yes, I've got a nice lady in Nelson that I go and see, and she's lovely.
And do you think so? Your experiences have all been positive.
Most of them have, yeah.
Yeah. Okay. What was the worst thing you've ever found with dealing with WINS?
Well, they seem to think that the money's coming out of their own purse, their private purse, instead of from government. So sometimes it's hard to get what you're entitled to. You really got to know. I was lucky. I went in with people who knew what WINS was, how to deal with WINS.
And so an advocate.
An advocate, yes.
Yeah. Okay, because they're not open about telling you all the things available?
No.
Okay. Do you think that's policy for them?
Yeah, I think so. I think it's government policy.
Have you ever needed help from Work and Income New Zealand?
Yes, I have.
Has it been helpful?
Yes, it has. They're actually good people. They get a bad rap, but at the end of the day, they do help when I need it.
Yes, today.
How helpful were they?
Very.
Could the experience have been better?
Absolutely.
In what way?
In a way that there shouldn't be so much paperwork. People like myself haven't been on a benefit or anything like that. It's just a whole lot of paperwork, it's just crap.
I do, as I'm on a pension.
And how do you find this service?
Very low. It could be increased quite considerable. As I say, it's a 65% funded, but that 65% is tax is taken out of that, so it's not actually a 65% funded pension.
Yes, I have.
And how has their service been for you?
I have no complaints. It was very compassionate, it was good.
No. Yeah, I haven't had experience in Work Income, and yeah.
It's been a strained time for West Coast policing in recent times, but now the final structure for the West Coast Area Police has been presented to staff. The new structure will take effect this year from September the 1st and incorporates 3 changes from the proposal document as a result of consultation process with staff and the community. The structure will include the establishment of a tactical squad, which was strongly supported by both staff and the community throughout the consultation period. West Coast Area Commander Inspector Mel Aitken said that as a result of consultation around the proposal to de-establish the constable position at Karamea, that decision has now been reversed. The flow-on effect of this decision is that a second detective position cannot be established in Westport. Inspector Aitken, who was recently confirmed as the new West Coast Area Commander, said the third change to what had been proposed was the decentralisation of the 2 prevention constable positions from Greymouth to Hokitika and Westport. He said that during meetings with staff and the community, he gained an understanding of the unique dynamics of the individual communities, which led him to believe the prevention constables would be most effective if based within those communities, but would be reporting to the prevention sergeant in Greymouth. These constables who will hold portfolios for family violence, youth and community services across the West Coast area. Inspector Aitken said the Tasman District Commander's commitment to consultation had been genuine, and she hoped that staff in the community would now get behind the new structure and support police to reduce social harm in West Coast communities. Currently, the West Coast Criminal Investigation Branch are investigating a suspicious fire which occurred at around 10:30 p.m. on Saturday the 28th of May 2016 at 34 Ranfurly Street in Runanga. As a result, the house has suffered moderate damage to several rooms. The address was unoccupied for several days prior to the fire. The Natural Health and Supplementary Products Bill now only needs to have its final reading before it becomes law. Acupuncture is part of Chinese medicine and will be affected by the new law, expected to take effect around June this year. We spoke with Paddy McBride of Nelson, whose role as immediate past president of Acupuncture New Zealand qualifies her to give us the organisation's perspective on what this bill will mean for them. Okay, well thanks Paddy. What are your thoughts around the Natural Health and Supplementary Products Bill?
It's been a very long journey. We've been working on it for a lot of years, and it does seem that we're getting closer to what is going to work for the most people.
And what's your role been, and what do you mean when you say we've been working on it?
Well, it started out that the Ministry of Health put forward a list of herbs and presumably supplements, but our perspective is the Chinese herbs. We've kept our focus specifically on Chinese herbs. There are lots of other people working on lots of other areas, but for us the Chinese herbs are the most important. So we've spent many, many long hours making sure that the herbs that we use on a day-to-day basis in our clinics throughout the country are included on the permitted ingredients list. It's been a lengthy process.
And it says that the claims made about the benefits on products will have to be backed by evidence. Is this an issue?
What we need to remember is that this particular bill, the Natural Health Products Bill, is specifically about herbal products that are sold over the counter. It's not for those herbal supplements or decoctions or formulas that are made up by a practitioner for a patient that comes in on a one-to-one basis. If you've had a sit-down session with a practitioner and a consultation, they've done a diagnosis and have put together a formula for you specifically, then that's actually not covered by this bill. The claims that are being put onto the labels of the over-the-counter products are to make sure that the general public are receiving accurate information.
And is there dispensaries around Chinese medicine in New Zealand?
We have a huge number of people throughout the country that are dispensing Chinese herbal medicine. Our organisation alone has close on 600 members. Not all practice herbal medicine, but certainly a large percentage do. So it would be in an individual clinic. We also have some retail outlets in different countries, mostly in the larger centres. But yes, there are certainly, probably more than most people would be aware of, people dispensing Chinese herbal medicine.
So how will it affect these retail outlets, with the Chinese herbal medicine being sold over the counter?
One of the requirements of the new Act is that the labels must be in English. I think that's going to benefit people in New Zealand particularly. At the moment it is possible to bring product in from China and still have all the labelling in Chinese. So you actually have no idea what it is that you're taking or where it's come from, or actually what it even is and what it's going to do. But if all the labelling must be in English, then you would hope at least that a rigorous process has been gone through in order to produce the New Zealand or the English label.
And with the herbs that you've worked on getting recognised as accepted on the list, who makes these decisions?
There is a panel of experts has been appointed by the Ministry of Health, and we have representation on that panel.
Has it been? You said it was a difficult process, and a long process.
More lengthy than difficult.
Pardon?
Because there are so many different herbs that are used on a day-to-day basis.
Oh, lengthy.
Lengthy rather than difficult.
Yeah. So has it been kind of how would you describe your process with government? Open discussion, or has it been a difficult process working with government?
Personally, I haven't had difficulty at all. I have actually found that we've had very productive discussion about the bill and about what our needs are, or the needs of our members. I understand that there are some organisations and some groups that are not quite as happy with the process as we have been. There has been some dispute over the fact that changes were made. We were asked to put in a submission on the bill by a particular date, and it then transpired that changes to the actual bill that we'd submitted on were made after the date of submission. Well, that didn't go down too well. That's not good PR.
And do you think this, with mainstream medicine, strengthens mainstream medicine with what's coming into effect with this bill, or it just makes no difference at all?
I certainly can't see that this would strengthen mainstream medicine. It will put us, one would hope, on more of an even footing. In Australia, the herbs have been regulated for quite some years now, and whilst there was an enormous amount of fear about that in the first instance, most of the herbalists are still practicing without too much difficulty.
And we hear that the bill should be coming into effect around June. Have you heard otherwise?
Yes. We have heard otherwise. It was hoped that it would be in place in June. In fact, it is now looking more like toward the end of the year.
Well, great. Thank you so much, Paddy. I appreciate your time and
That's
just
quite
bringing
right.
clarity just around some of those areas.
No problem at all.
Okay.
Anytime.
Thanks very much.
Thanks.
Bye.
Bye-bye.
Last week, the Minister of Finance, Bill English, announced his government's 8th budget.
On the back of an economy forecast to grow at around 3% on average over the next few years, supporting more jobs and higher incomes. This is a budget that invests in a growing economy. In particular, it supports 4 significant measures. The first is a $761 million investment in science, skills and regional development, the Innovative New Zealand package. The second is a $2.1 billion infrastructure program that focuses on transport, schools and the investment needed to deliver a modern flexible tax system. The third is a social investment package providing $652 million more to support vulnerable New Zealanders and help them live better lives. And finally, we make a sizable investment in the health sector, which which receives an additional $2.2 billion over the next 4 years to ensure New Zealanders continue to have access to high quality health care. I'll now take you through the broad outline for the economy. The world economy is somewhat weaker than a year ago. However, the domestic outlook remains positive. Treasury's forecast the real GDP growth of around 2.9% over the coming year and 2.8% on average through to 2020. Over 200,000 more people are in work today than 3 years ago, and another 170,000 new jobs are expected by 2020. The annual average wage has been increasing at twice the rate of inflation. And by 2020, it will have grown a further $5,000 to $63,000.
Leader of the opposition, Andrew Little, had this to say.
When kids are sleeping in cars, that's a housing crisis. When families are crowded into garages, that's a housing crisis. When an entire generation faces being shut out of owning their own home, that's a housing crisis. As a country, we pride ourselves on being compassionate and big-hearted, on looking after our mates and neighbours, on not leaving people out or leaving them behind. But in the last few years, that's been slipping away. After 8 years in office, one thing is blindingly obvious. This government has lost touch. They're increasingly interested in looking after the few at the very top and forgetting about everyone else. We see that in an economy where more of the gains of growth go to the mega rich. We see it in a housing market that rewards speculators while locking out first home buyers. We see it in a health system where people miss out on the care they need because of a lack of funding. That's the plan our current government is working on, focusing on the few at the top while it gets harder for everyone else. But it doesn't have to be like this. Under Labor, our focus will be on lifting people up and giving people opportunity. Our priority will be getting the building blocks of strong communities right: good housing, good healthcare, good education, and support when people need it. We need a government that will build a fairer country for everyone. That's what a Labor government will deliver with your support. Together, we can restore the Kiwi dream. Thank you.
So we went and asked people in Nelson what they thought about this latest budget.
What did you think about this year's budget?
I didn't think much of it, to be honest. I leave that to the politicians. The fact that cigarettes are going to be going up to $30 a packet by 2020 is a bit worrying. I don't know how I'll afford that.
No thoughts. I've got no thoughts about it, eh?
Well, I think it's pretty lean, especially in the gold cards and health. I think we could do with far more health. And the low budget is definitely needs looking at.
This year's budget is, I don't think, as good as it sounds, because I think we could do more in several areas like housing and medical.
I think that John Keys just doesn't know how to run the country, and I don't think he should put the cigarette prices up because people are already addicted, so it's just going to make it harder for families and all that. Yeah.
You gotta see what the people want. You know, it's just important what the people want. If they get what they want, then a lot of people will start coming to New Zealand and start supporting this country, and good things will happen. Yeah.
And finally, rounding up New Zealand Music Month today, we will leave you now with Tasman musician Ali Cook's latest video filmed on Takaka Hill, Message in a Cloud, which was #1 for 3 weeks and has dropped to #2 for the last 2 weeks, while currently sitting at #15 in the UK Hot Disc charts. After the break, we'll bring you the latest weather update and some events and happenings coming up from around the region.
Why would you want to pay as much as $1,000 for a single bed mattress when you can buy a high quality locally made mattress like this for as little as $220? And a queen size mattress could cost you in excess of $3,000, but at Nelson Beds you could have a mattress like this as low as $425. So why would you go out and spend a fortune on your child's bedroom when you can come to Nelson Beds and buy a complete single mattress and base set, a 7-drawer Scotch chest, a headboard and a 3-drawer bedside cabinet for as little as $979? So call and discuss our custom manufacturing options and local after sales service at Nelson Beds, Nelson's only bedding manufacturer.
Hi there, Julian Toon, Waimea Telecommunications. We install and maintain domestic and commercial satellite TV, UHF Freeview and Mainland TV installations in the Nelson, Tasman regions. We specialise in Panasonic telephone systems and provide communications, Wi-Fi, IT and wiring for internet, fibre, computers and DSL systems. At Waimea Telecommunications, we also provide specialist electronic systems for features such as a security camera you can watch on your TV, visitor alert systems and much more. Improve your security and communication and entertainment today. Call us on Waimea Telecommunications on 021 472297. ytel.co.nz.
We're the team at JCar, right here in Nelson, 120 Hardy Street. Our shop is full of electronic items,
including security alarm systems, electronic components,
solar and power,
electronics toys,
sound systems, cables and much, much more.
JCar. 120 Hardy Street, Nelson.
World War I was a defining period in our history, impacting greatly on the lives of people from the Nelson province. Memories of the First World War is an exhibition which will be displayed in a number of regional venues and is currently on at the Nelson Provincial Museum.
Nelson Public Libraries welcomes Matariki, the Māori New Year, with displays, workshops and events at the Alma Turner Library. Matariki is a small but distinct star cluster whose appearance in the northeastern pre-dawn sky in early June marks the start of a new phase of life. Celebrations most often begin at the next moon after Matariki has risen. The celebrations will run from Tuesday the 7th of June to Friday the 1st of July, with free events open to the public throughout this time, allowing people to learn more about Matariki and its importance in our culture. You can find out more through the Nelson City Council's website. On behalf of the team here at Mainland Television News, thank you for joining us, and we'll bring you the latest news and events from around the region again tomorrow.
Supporting local content so you can see more of New Zealand on air. Hi, I'm John Crouch. I'm Crafer Crouch Construction. We're general contractors here. We specialise in drainage, earthworks, concrete, gravel supplies. We have our own mobile crushers. So for all your contract requirements, call us on 5783 475 Blenheim or in 5736 119 Picton.
Why would you want to pay as much as $1,000 for a single bed mattress when you can buy a high quality locally made mattress like this for as little as $220? And a queen size mattress could cost you in excess of $3,000, but at Nelson Beds you could have a mattress like this as low as $425. So why would you go out and spend a fortune on your child's bedroom when you can come to Nelson Beds and buy a complete single mattress and base set, a 7-drawer Scotch chest, a headboard and a 3-drawer bedside cabinet for as little as $979? So call and discuss our custom manufacturing options and local after sales service at Nelson Beds, Nelson's only bedding manufacturer.